Hello everyone, welcome to sqadia.com, and in our final section we will talk about the germ cell tumors. And when we will talk about germ cell tumors, we will talk about dysgerminomas, immature teratoma, and endodermal sinus tumor. So germ cell tumor, mainly you have dysgerminoma, and then we have embryonal carcinoma. So germ cell, dysgerminomas, and embryonal carcinoma. So embryonal carcinoma is further divided into tumors of extra-embryonic cell and tumors of the embryonic cell. Tumors of extra-embryonic cell again further divide into two: endodermal sinus tumor and choriocarcinoma. And then the tumors of embryonal cell divides into teratoma, mature and immature type of tumor. So basically, germ cell divided further into two: dysgerminoma and embryonal carcinoma. Embryonal further divided into two: one is tumors of extra embryonic cell and tumors of the embryonic cell. Extra embryonic, two types: endodermal sinus tumor, choriocarcinoma. Embryonic cell, we have teratoma, mature and immature type. So in dysgerminoma, the pathology is it's round or oval, and it's 5 to 15 centimeter in diameter. If you see, it's really big, 5 to 15 centimeter in diameter. It's boggy or rubbery. The feature you can see is like a rubbery. It's 10% of the cases is present both sides bilaterally. It's monotonous pattern and hyperchromatic and irregular nuclei. Hyperchromatic, it's little bright in color. Chromatin is like a deposits of the iron deposit things here. If you see, it's a bright in color, dark brownish in color. Treatment of dysgerminoma, if we see, is unilateral salpingio-oophorectomy is done, and then chemotherapy, systemic chemotherapy, and finally radiotherapy is done. So again, surgery, chemotherapy, radiotherapy, that's the usual treatment for most of the carcinomas. So in chemotherapy, usually there is carboplatin is used about every 4 weeks for 6 courses. It is given intravenously. And then there is a combination chemotherapy, BEP, which is bleomycin, etoposide, and cisplatin. Vinblastine, bleomycin, and cisplatin, and then VAC, which is vincristine, actinomycin, and cyclophosphamide. So these are 3 main combination chemotherapy methods used. And then radiotherapy is also effective for the dysgerminomas. Immature teratoma. Immature teratoma is the third most common germ cell malignancy. In this, you see there are pathologically it contains undifferentiated tissue. So usually tissues are not very differentiated. You cannot classify or diagnose what tissue is it. So it's undifferentiated. Grade 3 tumor has poor prognosis, and teratomas usually contain different tissues. They have muscle, hair, some nail tissues, so it's undifferentiated. Different tissues are present. Treatment is unilateral oophorectomy, removal of the ovaries with staging, and then chemotherapy is done. This is under the microscopic picture of the immature teratoma. Then endodermal sinus tumor, second most common germ cell tumor of the ovary, 20% is endodermal sinus tumor. There are Schiller dual body is present. This is the name given after the scientist who found this. And then this is like a diagnostic feature present under the microscope. And the treatment is staging, salpingo-oophorectomy, and chemotherapy is done for this also. So that was about the dysgeminomas, immature teratoma, and endodermal sinus tumor, which are the 3 types of germ cell tumors. Thank you for watching sqadia.com.